Please welcome the CEO of our second charitable recipient, Rabida Children's Hospital, Ms. Brenda Wolf.
Hello, everyone. Thank you, Robin. I hope you all enjoyed a peek behind the scenes of Rabida. Thank you also to Major League Baseball, the Chicago White Sox, the Reinsdorf family, Rabida trustee Bob Arthur, and Magellan Corporation for providing us with such a wonderful weekend of exciting and meaningful activities. Rabida Children's Hospital is especially grateful for the many, many ways you have all shown support to our patients and families. Your players make our patients like Rashawn feel like VIPs on the field. Rashawn came to Rabida for rehabilitation after being shot in the head in a drive-by shooting on Christmas morning. His therapist at Rabida motivated him towards recovery through his love of baseball. Christine O'Reilly from the White Sox even sent a Dorian, an 8-year-old, who had suffered third-degree burns, a replica championship ring when he asked her for hers during a visit. She didn't give it to him. Eliakim is another wonderful little boy. We can never forget this young man throwing out the first game pitch. His parents were told that he'd never walk, but after a number of years of outpatient therapy at Rabida, he took to the mound like a real pro. Time and again, the White Sox has embraced Rabida's mission to provide quality health care to Chicago's most vulnerable kids. This opportunity today provided by Major League Baseball and shared with the esteemed company of the Chicago Urban League is further proof of the support of our missions. Like the Urban League, we serve a unique role in Chicago. In fact, there is no other pediatric hospital in the region like Rabida Children's Hospital. Our dedicated physicians, nurses, social workers, and therapists provide amazing services and care that our kids and families so need and deserve. We offer care for kids with lifelong conditions and complex medical needs. So who are Chicago's most vulnerable children? They're kids with chronic conditions like sickle cell disease, diabetes, Down syndrome, and cerebral palsy. Some of our patients need transitional care. They come from neonatal and pediatric intensive care units from other Chicagoland medical centers as a step towards going home. And they're children for whom we provide a medical home. In fact, our Premier Kids Medical Home program, which serves infants and toddlers, is supported by the White Sox charities. These are outpatient programs where our primary care physicians and specialists provide one-stop shopping, a central hub to meet all the child's needs. And that need is really what we mean when we talk about Chicago's most vulnerable children and their families. Not only do our kids face lifelong health challenges, but their families face serious obstacles brought on by poverty and other adversities, obstacles like access to appropriate education, child care, housing, and transportation. Quite frankly, without Rabida, many of these kids would fall through the cracks. Our teams focus on removing obstacles. It's teaching parents to care for their children, to get them home and keep them home. It's addressing the mental health needs of the entire family. It's assuring that these kids with special health care needs get the appropriate early intervention and education from the beginning of their lives, including providing after-school tutoring right at Rabida. It's working with and empowering our parents to become advocates so they can navigate the maze of agencies and organizations to get services. And we are there 24/7 to listen, support, empower, and advocate. Rabida is committed to providing quality health care to those most in need, minority families who rely on Medicaid to cover their health care. This commitment has been at the cornerstone of our mission since 1896 and will be there for generations to come. These are the people Dr. King was talking about in his historic I Have a Dream speech as we commemorated that 50 years ago. Thousands gathered on the Mall with the backdrop of the Lincoln Memorial to protest social injustice, inadequate housing, inequalities in education, voting access, and more. Dr. King's vision evolved to include equal access to health care. 3 years after the historic speech, he referred to healthcare disparity among the nation's rich and poor to be, quote, the most shocking and inhumane. Certainly, we've made great strides toward that vision over the past 50 years. However, much work remains to reach that dream. Please know that La Rabida strives to be part of the solution. Together, we can advance our vision to raise possibilities for every child whose lives we touch. And we so appreciate being part of this very, very important day. Thank you.